If you have a labral tear in your shoulder, would peptides like BPC 157 help it heal without surgery? Would regenerative medicine options like stem cells, PRP, or exosomes help? I'll discuss these treatments in this video. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injuries. This video is going to be very similar to one I did just a few weeks ago on regenerative treatments for a meniscus tear. I feel like they're very similar injuries in terms of what the potential role for regenerative treatments are. So definitely check that out. If you didn't see it, it's in my modern medicine playlist on this channel. But before I get into the specifics of the labral tear and regenerative treatments, I do want to say that when I talk about whether it's peptides, exosomes, PRP stem cells, the FDA and insurance companies consider these treatments experimental. I'm not pushing them by any means. I'm not telling you that you should do this. This is not medical advice. I just get so many questions based on my background and certification and board certification in anti-aging and regenerative medicine and my peptide therapy certification. I get so many questions about would these be helpful for so many different injuries. I probably get more about a labral tear than almost any other injury, honestly. And so I do want to put information out there that at least educates you as to what the role of these might be. I have tons more videos on that playlist specifically about potentially where you should and shouldn't get peptides, not from online sites, in my opinion. I've got a whole video on that if you want to check that out. But what type of physician to look for and certifications and qualifications and just all sorts of ins and outs about what the treatments are. I'm not going to get into the weeds on this video, but want to put it out there. Okay. The labral tears of the shoulder. The labrum is the cartilage bumper along the socket. And there's different places that can tear. It can be at the top of the surgery in manual laborers and throwing athletes. It can be toward the front or the back, toward the bottom in somebody that has suffered a traumatic injury like a shoulder dislocation. Those typically do not heal without surgery or heal on their own. Just like the meniscus tear of the knee typically doesn't heal on its own. Doesn't necessarily mean that you have surgery. You have to determine, is that the source of the pain and would that necessarily help? But surgery for a labral tear to repair the labrum, reattach it with stitches and anchors is a big surgery. It's an outpatient surgery. The surgery itself takes about 30 minutes. It's arthroscopic. But the recovery is anywhere from 4 to 6 months, depending on the nature of the repair. It can be up to 12 months before somebody gets back to the same level of sports and exercise. So there's a lot of interest in, hey, what could potentially keep me from needing that? And that's where people have asked, specifically what I get asked about are, would peptides be helpful? BPC 157, thymosin beta 4, even something that strengthens muscle, potentially a peptide like CJC 1295. I am skeptical how much peptides, even if it was given as a subcutaneous injection near the shoulder, you put it in the deltoid or something like that, how much that actually would get into the joint and help that heal. One, peptides have never been studied for labral tears or meniscus tears, intra-articular injuries, animals or humans, so it's hard necessarily to know how much that would help. Might help alleviate the pain, but I'm a little suspicious that it would help that much getting into a joint and causing that labrum to heal. Now, maybe peptides might have a role in, yes, I'm going to go through labral repair surgery, but I'll potentially work with my doctor and have him or her prescribe me peptides that I give myself to help me recover from that surgery faster, strengthen the tendons and ligaments and the muscles around the shoulder to basically speed recovery, speed return to sports and exercise. There may be a role there. Again, it really hasn't been studied in any population as it pertains to labral tears, but there could potentially be a role, like I said, but I think it would be more in the recovery from surgery. If there was going to be a regenerative treatment to help that labrum heal without surgery, I would expect it would be more in the more regenerative injections into the joint performed by an orthopedic surgeon, whether that's PRP, which has been studied for a number of treatments. Even that has not really been shown, to my knowledge, to definitively help a labral tear heal without surgery, but might increase the chances of that. That's where you have a little bit of blood drawn up. The surgeon puts it in a centrifuge to spin off the red and white blood cells. Now you have concentrated plasma, concentrated with platelets, injected into the shoulder to release their growth factors and try to get that to heal. Stem cells, exosomes, even much further down the experimental route as it pertains to the FDA, but it has been at least suggested to potentially even be better for healing tissue. Now, that's really more been studied in the osteoarthritis world for articular cartilage and the subchondral bone, but there are a number of people that say, hey, this is where it's headed in terms of getting tissue, musculoskeletal tissue, again, tendon, ligament, muscle to heal. It just, again, hasn't been studied for labral tears. If that's something you're like, hey, for a variety of reasons, this idea appeals to me, I'm really trying to avoid surgery for all sorts of reasons, you could ask a doctor, or what I would say is an orthopedic surgeon who treats labral tears on a regular basis, if this is potentially an option for you. Find out the pros, cons, and have a discussion. And I hope this information at least gives you a little bit of information to then take to that doctor and say, all right, what are my options? And you make the decision that's best for you. Now, I'd love to hear about your experience with your shoulder injury. Leave those in the comments below this video. Just understand, if you leave a question in the comments, I can't give you medical advice in response to that. But what I'll do, like I did here, is I can answer that question in a future video. Make sure to subscribe to this channel, click the bell to be notified when I release a new video and when I start my live streams, including my Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.